Health Minister Claire Christian has been under fire this week for telling Tynwald there'd be no cuts to health services and then cuts being announced. The beleaguered minister rejects suggestions that she had misled Tynwald and joins me now in the studio. It is fair to say that you've been coming in for some criticism in relation to when is a cut, not a cut. So perhaps if we start off with that particular issue. At a time when Manx Radio was certainly aware of a draft press release talking about cuts, you were in Tynwald saying that there were to be no cuts. Is there a misunderstanding somewhere along the lines here, or were you misleading Tynwald?
Thank you, Phil. On the 21st of January, Honourable Member Julie Edge asked if I'd make a statement about the possibility of strike action by doctors. That was the question. And I was pleased to announce that in Tynwald that day that the latest pay offer of the doctors was being considered formally by the BMA, which resulted in that strike action being deferred. There obviously was then supplementary questions asking whether the doctors' pay, as you said, would directly would lead to threats or cuts in services or extra budget being required by Manx Care. And in response to these questions, I advised that it wasn't. That there would not be any cuts as a direct result of the pay offer.
And you were questioned quite a lot on this because members, particularly I think the former health minister, Mr Hooper, who seems to have been very vocal on this, had concern as to where this extra money was going to come from, because on the one hand you were saying there would be no cuts in services. You also said that you didn't think there was going to be a need for additional money from Treasury, and you weren't able to give a straight answer at that stage.
Yeah, it was still obviously as I said in the morning, it had only just been approved in the sense of, well, not approved, but it had just been deferred the strike action. So Manx Care, you're absolutely right, doesn't have the sufficient funding within its existing budget to make that pay offer. Apart from what was proposed last autumn, but the new offer had been made with additional financial support from the Department of Health and Social Care budget. Right,
and was that in relation to changes in working practices? Was the money to be found through that, or how did that work?
So you're right. On top of that, building on that sort of the dialogue and the communications with the members of the Anima Medical Society and the BMA, there is further work planned on reviewing the medical workforce planning, and we hope that will also offset some of that cost. So at the time you were answering this question, which was, to be fair, specifically about the doctor's pay dispute, do you not think it might have been helpful to have clarified that just because you were saying there would be no cuts in services relating to that didn't mean that there wouldn't be some cuts in services? So I think it's important to be clear that prior to those questions, Manx Care, as you said, Manx Care had put out a press release, and
this was embargoed.
This was an embargoed press release, and I hadn't seen the press release before it had gone out, or to the press. Once it was shared with me, I requested that it continue to be embargoed while the department could meet with Manx Care, the DHSC could, and the members of the department could meet with Manx Care to go over the proposals that they were making, and they were operational proposals.
Because at that time, Council of Ministers, well, you hadn't seen it, so I guess Council of Ministers hadn't seen this either.
So I think they saw it approximately at sort of a similar timing as I did. But I think that that's important to say, that it's not that we could direct Manx care at that point, but we needed to obviously review this politically, because the reasons they were doing that was because they were currently at a financial position of being 15 million overspend, and they were looking obviously at ways of not going further over that 15 million. So that week, there was obviously negotiations and meetings regarding this, and it wasn't till this coming last weekend, Phil, where I basically put together reasons why I didn't think the part of the on-island elective care should be stopped. I put together a proposal to try to prevent that from happening. I'm just going to take a little drink.
I should say that you've come in to record this with me off your sick bed, it's fair to say. So in the midst of this week with all this happening, you've been struggling with one of the many bugs that's going around. So effectively, I don't know, you explain your thinking. You wanted the on-island elective surgery. You didn't want that to be impacted.
And the reasons for that were... obviously, if you stop elective surgery, that's going to mean that the waiting, they'll have to be put further down the line and lengthen waiting lists. We had just spent, I think it was 18.3 million on the restoration and recovery programme, which was where Synaptic came in, did cataracts, etc., and others, and for me, we'd just done that really good piece of work where we had improved waiting lists, only for us then to be making a suggestion to slow that down. Did not seem right from my perspective.
Well, it would be a pretty ridiculous waste of public money, wouldn't it?
Absolutely.
So effectively, by what was being proposed, the waiting lists that had been substantially reduced would then substantially increase again.
They perhaps not substantially, but they would have increased, and from that perspective, but then also from the perspective of that, we have senior clinicians and surgeons that perhaps, let's say for example, they work 1 day a week, actually on operations that would have stopped, and that for me also wasn't value for money. We're paying for these people to do that job. And those are fixed costs, but the savings were going to come out of the locums and the agency staff. So those were the first two reasons. The third reason that I felt that obviously, as I've said, is the ongoing waiting lists, and also with a really, really important message to say to the public that I didn't support that, mainly because of the quality of life for these people. So if you were meant to have something happen in February or March, the quality of life for them would have been whatever the issue that they were having in terms of an elective. And these are non-urgent operations, but they're still improved the quality of life for those people. So for me, I wanted to make sure that continued. So on the Sunday, I spoke with the Chief Minister, and I spoke with the Chair of the Manx Care Board. And then Monday morning, I got some information through to Treasury on what the cost to keep the on-island elective would be, which was 800,000. And Treasury then, obviously, they requested that I bring that to the board, the Treasury board, on the Wednesday morning. And in between then, yes, it was this week. Obviously, we had the House of Keys. I was going to make the statement that about the tertiary electives, and that we would be having the meeting with Treasury Board on the on-island electives the following day. So, I know that obviously, in hindsight, Phil, back to your original question about the did I know about cuts, and was there a possibility of me misleading? I feel that I was answering the question in terms of did the pay awards would they cause cuts? But in hindsight, I can see at the timing of this, I mean, if the timing of this had been in a month or 2 months down the line, there wouldn't have been that correlation. But because of the timing of it, there is that.
The other element to these reduced services, of course, was off-island services. How has that been affected by all of this? I mean, are there actual cuts? I mean, certainly Manx Radio is receiving messages and calls from patients who were due to go across and now are being told that their appointment's been cancelled.
The off-island elective, so 75% of the planned work for the next 2 months was follow-up appointments. And in the UK, I think since 2019, I understand there's been a big piece of work with the NHS in England, whereby they've been looking at follow-up appointments, and it's almost like a self-referral follow-up, and that hasn't really, that piece of work hasn't come through into Manx Care. So this has to be done regardless of what's it was planned validation work, but this is obviously happening now. So what they're doing is they're looking at those follow-up appointments, and they're making sure whether they are needed, and the clinicians are doing this. So just to really be assured, the clinicians are doing that, whether they are actually needed, whether they can be done closer to home. Because I know I've had lots of friends, constituents. I'm sure you know people, Phil, where they've said that they've gone over and literally had a 1-minute conversation that perhaps could have been done virtually, could have been done by a clinician here on the island, and then there's obviously that cost to get those people off the island. Perhaps there might be a cost for a companion to go with them too, and obviously we've then got the cost of that clinician in the UK seeing them.
But it's more than just those sorts of appointments.
That's the first part to explain. That's why I can support that. The second part was obviously to say that the emergency and cancer appointments were obviously continuing. And when they say emergency, it was priority 1 and priority 2. And from my understanding, there has been a confusion with the off-island providers, that wasn't clear. That message wasn't clear that priority 1 and priority 2 should continue. But that has now been rectified.
And I suppose for the patients affected by that, what would your message be? Because if it has been a miscommunication, this is having a significant impact on them. I'm
sorry for that, Phil. I'm really sorry for that, because that would be absolutely worrying for them, and I'm sorry that that's happened.
In terms then of the ongoing situation at the Department of Health and Social Care, and particularly Manx Care's budget, is there any light at the end of the tunnel that you can talk to us about?
I think we've got to be really realistic about the budget, about what it can provide. The piece of work that the Chief Minister started on aligning the mandate with the operational plan and the budget is the piece of work that I'm working on now. And it's being honest and transparent about what we can actually provide within that budget. And I think that, it's really good for the public to understand that we need to be really clear there isn't enough money. But at the same time, we do need to, and we have been doing that. We've been deep diving over the last 8 weeks with these 2 specialists that we've brought in to make, they are operational and financial assurances and governance, better governance over what's being planned, and. So yes, we can make efficiencies, but at the same time, they're not going to happen quickly, Phil. So I think that's what the conversation is now going to. It needs to move on to. This is what we can afford, and that's going to be, some of those answers are going to be really tough, because there's going to be some decisions. Inflation's obviously raised at a great rate. Drug prices have gone up, increased. We've got, I think, the Manx Care CEO mentioned yesterday that there, just one patient has £500,000 worth of care, and those type of patients it has increased. Whether you get 4 or 5 of those, that's something that is unplanned and can happen.
And of course, what we also know is that there is a growing demand for health services. First of all, people are living longer, so as they get into their later years in life, they need more health services. Added to which, the health service is getting better at fixing more of the problems that we face in terms of our health. So you're kind of fighting a very uphill battle here. So
I think just the light at the end of the tunnel for me is I'm going back to what in essence, as an MHK, as a constituency MHK, what have been the issues on the ground. And those issues on the ground have been getting a GP appointment, getting a dentist appointment. And me coming into this role, this is going to be when we do start to talk more about what's in the mandate and what's in the operational plan. I have indicated prior to that I want to see more investment in those areas, and that for me that's really important. And I always kind of just explain this in the sense that community care is really important. Being able to get that appointment is really important, and again, it improves people's quality of life, and that's the island plan. We absolutely want that. The problem has been, one person might not be able to get an appointment for 3 weeks, and then they end up going to meds. There's another cost, and then that's not worked either, and they ended up in the A&E, and there's an extra cost. That we want to try and prevent people from ending up down that pathway and seeing a GP, or seeing the right need for them, whether it's a physio in the community, whether it's mental health in the community. So it's seeing that right care in your community. So for me, that's a really important piece of work, and that's the light at the end of the tunnel, because that's been a really big push or big questions from my constituents, and certainly from the wider public.
How long have you been Minister now?
I think it's 8 weeks.
And has that been a baptism of fire?
I think that there's a massive shift in going from a backbencher to a minister, and I'm trying to remain as myself in all of this, because I think that's really important for the public. I don't want to get the phenomenal cominitis that everybody says you get once you go in, and I want to keep that real, and so it is very different. The level of work, Phil, I mean, you'll probably remember, I'm and this isn't by any means any complaints, because I'm a hard worker, but the level of work is, you're up till midnight, and you're working weekends, the whole solid, so I have been going at this for 8 weeks, pretty much 7 days a week, the odd day off here or two, but even those days off, you never switch off. And then on top of that, it's a massive department, but on top of that, you obviously have the council and minister side as well, which is all the papers you have to read, etc. So it is very different, and but I'm really grateful to be in that position, and I hope that that there's been a couple of things which I feel very strongly about. So firstly, the pay awards. I hope that I made a difference there, and with something like the On Island, I hope I made a difference there to keep that on island. So if I hadn't been in this position, or I hadn't been in this role, I hope that if whatever happens now, Phil, I hope that I can walk away and say I made a difference there.
You're not planning to walk away soon?
No, I'm not. That I'm certainly somebody who really likes the challenge and wants to help. This is a massive responsibility. This affects everybody here on the island, the healthcare, and I do understand that that's a great honour to do that. But it's certainly not easy, Phil, because I'm coming into this job 3 years into 3.5 years into an administration, and I'm obviously inheriting a lot of the issues and a new system. Manx Care is only an infant in that sense. It's 3 or 4 years old, and that now, actually, me coming in is a really good timing for us to review that. Let's review, is that governance, is that system really working? Is the DHSC working? What's that role? What's the political role? Is that how we wanted it to be? And that review is happening, and we will be bringing back to Tynwald a report on what our findings are in May.
Did Laurie Hooper jump too soon, do you think? Because it would appear that you have been successful, perhaps, where Mr. Hooper wasn't, in persuading council ministers that they need to back you in relation to the overspend, which sounds as though it's going to be something similar to what Laurie Hooper had and was being told he needed to find the money.
I mean, I'm not going to sit and throw shade over another politician. I don't think the bank's public want to hear that anymore. I really don't. I think they just want to know, can we work together? And I absolutely can work with Mr. Hooper, and I would absolutely ask him, to come and see me. He hasn't approached me during this time, but I would absolutely ask that he does if he has concerns. I think that he has obviously done also a very good job, in my opinion, over the last 3 years, in the sense that there's a lot of good things that have happened and have progressed, for example, which I mentioned earlier about the R&R, and I think that it's really important that, as I said, the Manx public don't want to hear me throwing dirt, I think they call it. I think they just want to know the facts, and they want to know that we're doing as best job as we can.
And you do have significant political support in the department. Is that at times a hindrance, because effectively you're the minister, but then you've got two other ministers in watching everything that you do? Yeah,
we had to establish that in the first meeting that I was the only minister in the room to be named that, because otherwise it was difficult. Minister. It was just too complicated. I think that having the support of the two ministers has been helpful to me, mainly because certainly picking up this huge department, and also in terms of just things like processes to do with COVID and things like that, so that has been helpful, but then that's not going to be long term. I will need to appoint members, and I look forward to doing that over the next coming months, and obviously having a nice handover period in that sense.
And are there specific delegations to the ministers, the other, or your department members who happen to be ministers?
Yeah, the mandate is an area over for David Ashford. Obviously, Tanya August Hansen is in the legislation, and it's really. In one of my conversations with Mr. Hooper very recently, he said it's really important that you can delegate, and that was something that he did really well. He had the support of his members, and that's a piece of advice that I know when I was a member in desk supporting that minister, Julie Edge was really important, and being able to take the projects and take the things and being able to run with those and deliver.
And of course, in the public eye, the minister or the buck stops with the minister. But it is important, as you say. I mean, you can't be everywhere. You can't do everything. So having political members you can trust, and trust to delegate functions to is very important.
And I think also it's having that corporate memory. Phil, I think as new politicians come in, they obviously haven't got that corporate memory, and you rely then on civil servants, and that isn't always, I'm not saying it's not good, but that it's good for you as a minister. For me, I think to have lots of advice, and I think certainly from a perspective of Mr. Hooper, for example, he does have that corporate memory. So, it's important for me to not, to be humble and say, actually, what happened during this, and, what were the reasonings for that. So I think that's important to just, bear that in mind.
And often, I think, in my experience of having departed as minister from, I think, 4 different departments or 4 different ministerial roles, it's actually quite nice to be asked by the minister that succeeds you to give them a little bit of advice and tell them where potentially the skeletons are buried.
Yeah. I mean, I think that obviously I'm in this department, up till I'll be still minister during the election period, but it's obviously whether I get in again or not, and then what happens in the next administration. But I'm making decisions for the long term, because I think that's also really important. Not viewing this just as an 18-month gig. This is really important.
And that's a really hard thing to do, isn't it? Because inevitably, you want to have relatively quick wins to be able to demonstrate to your electorate and to the Manx public generally that actually this minister's doing a pretty good job. But many of the problems that you face don't have quick win type solutions, do they?
No, they don't. And because you make changes now and you won't see a lot of, certainly financial ones, you won't see the financial implications till a way down the line. So yeah, that is difficult, but I guess as I said before, there's certain wins that you can do. I'm going to be setting out about the community care, about what hopefully I will see and what the public will see in a year and a half's time, and I think that's really important. And then obviously long term, so that we can have some measurables there. Because
of course the other I suppose possible elephant in the room in relation to your role is the funding of social care, and particularly the gripe that many people who have some level of wealth have, that they end up having to pay substantial amounts of money for their care when they need to be in care, whereas people who don't have any wealth basically get the service provided for them. That's a difficult question, which many governments, both on the Isle of Man or in the Isle of Man and across the water, have discussed and suggested that maybe they had some ideas about potential solutions, but the nettle never seems to have been grasped.
No, it's financial, isn't it? It's what you can afford, and it's obviously we work bottom up in that aspect. We obviously look at the most vulnerable people first, and work our way up from there. And I think it's always that, you're right. It's always going to be a really difficult to resolve that.
But there is some level of commitment, I think, from the department to come back with some solution.
Yeah, absolutely. And as I said, that in the mandate and the operating plan, we will be clear. I think the most important thing is clear what we can afford, Phil. And I think that's going to be the part where honest conversations have to be had, and where we can go looking forward. And I think that's I'm not saying that hasn't happened before, but I think we've got so much more information now over these past couple of months with the two experts really going in and really being able to validate what are the pressures in Manx care and what can be made efficient, and that information, bringing that now to the Council of Ministers and to the wider public, that piece of work is really important.
Going back then to, first of all, the urgent question that Joni Farragher had down for Keys. You were unwell and unable to deliver the answer. But you do have members in the department. You've got two ministerial colleagues who sit there. Would it not have been sensible to have handed over the answer to them and allowed them to give that answer?
So I think that, just to be really clear, I was in at 8 that morning and with every intention, but the more people I saw, the more they were like, please, absolutely, will you go home, because you're really not well. And I don't like letting people down, Phil, I really don't. It was the last person I saw was the Chief Minister at sort of 5 to 10, and at that point, I think it would have been unfair to have expected Jane Paul Wilson, who was because David was also not in attendance, to take that at that such short notice. During that morning, well, I heard that it was going to be moved to a written question, so the statement would have gone out, but then it was changed to an oral question, so we didn't quite have that ability to put that statement out straight away afterwards. And obviously, as I said, the meeting happened the next day with the Treasury Board, so and what's transpired has transpired now.
So, summarising then the position, some elective surgery in the UK has been cancelled in error. Some follow-up appointments have been cancelled, which you were in agreement with, and basically the situation in the Isle of Man remains pretty much the same. Is that
Yes.
pretty much the message?
Yes, that's it.
So, and you've already apologised, I suppose, to those who've been impacted by those cancellations that shouldn't have been cancelled. Presumably, there will be some kind of internal investigation within Manx Care to say, well, actually, how have we got to a position where we said one thing and you've interpreted like this? Yeah,
absolutely. I think that those communication relationships need to be reviewed. I think, let's be really honest here, Phil. This we over the past week, things could have been handled differently, and I absolutely am aware of that. One of the things that really this stems from is basically operational, and this is how it is. This is how it is. Manx Care makes operational decisions. Some of those operational decisions obviously have huge political and public impact. That's the point. So what I have agreed with the chair of the Manx Care Board now is that when they have their board meetings to discuss operational, to discuss what's going on in Manx Care, that we will be immediately, there'll be a meeting afterwards with the political team and the department, and we will be briefed, and we will then be able to have an agreed period of time to look at what that impact would be, and to really go over the comms.
And that seems like such an obvious thing, doesn't it? I mean, the Manx Care Board has been criticised for largely not living in the community, mainly being people from across who come over for meetings and the like. Do you think because many of them don't live in this community, that's part of the problem, that they don't realise just what a big political issue this is at the moment, and how big a deal that the draft press release, which ultimately didn't see the light of day until Laurie Hooper leaked it, that had the potential to well, certainly destabilise your position.
So I think that, from what I'm explaining is that we don't want, we're not DHSC, otherwise there's no point in Manx Care, but the DHSC should not be making operational decisions. But there is political impact, and there is massively public impact. And they were Manx Care were following instructions that they were to come in on budget as close to possible, and they were making operational decisions to achieve that. So this is an extraordinary situation in that essence. So day to day, we're not going to want to know whether they're changing the soap and whatever, or they're changing a ward structure or something. That day to day, those things, operationally, they should have the autonomy to do that. But when, and this would be the only thing that they would bring to us in that briefing, would be if there was something that was going to impact the public, and I think that line has been sort of established, and my relationship certainly with the Manx Care Board, that's been something I've really built up from day one, meeting, speaking with the chair every Monday, really getting to understand what their issues are and understand what their problems are, and building that relationship up has been really important for me. And as I said, that as a result of the things that have happened over these 2 weeks, we're now looking at how we can improve that.
Is the relationship between the Department of Health and Social Care and the it's not really newly established, but three-year-old Manx Care, is it capable of working?
So the way that Manx Care is set up and the way that the DHSC is set up, I think that we are encountering this because we're a small island. It's almost like we have, I guess if you made a comparison, we have one NHS trust over here, but it's obviously not, but that would be the equivalent. And we need to understand, really, should politicians only be involved really at certain points if it's in the public interest? And I think that clarity needs to be drawn out. But at the same time, it has been very clear to Sir Jonathan Michaels that it is important that that Manx Care, or that's how it's been set up, should be autonomous, and politicians shouldn't get involved in this person should be seen before so and so, those absolutely categorically things.
But I suppose I'm guessing if I were a member of the Manx Care Board, I would be thinking, based on recent events, all I need to do is threaten that certain services may be cut, and the minister and various politicians will come rushing in, demanding that more money is provided to Manx Care to ensure this doesn't happen. How do you avoid that?
So I think that the current situation, so this year, they're obviously at a position where they're overspent. So they've not. They can't make much savings in the next 2 months, Phil. Let's be frank. So if there are additional winter costs, if there are things that come about in the next 2 months, they're going to need that support because they're over budget now. But going forward for next year, that's the part where being now saying this is what we can afford, this is what we can do, and maintaining that and watching that over the next obviously 12 months, every single month, making sure that the run rate, however it's set, that they're coming in on budget, and making sure that that's working. So I guess in answer to your question, it's kind of going back to the fact that we have deep dived in the last 2 months, and it is being able to say that We know that efficiencies can be made, but that efficiency, we're not going to see a cost benefit probably till month 6 on that efficiency, or month to 8, or, and we're not necessarily involved in that level of detail, but Manx Care are now working with the support that we've given them to be able to say, that we can change that, we can make those efficiencies, and we can drive better value for money.
That was Health Minister Claire Christian MHK. Ramsey MHK and former Health Minister Laurie Hooper has been very critical of attempts to address the substantial health overspend that he left behind. Does he accept any responsibility for allowing health spending to get out of control?
So as I've said multiple times, and I will keep saying until people start actually listening, healthcare is expensive. And you have an ever-growing demand on healthcare. That's inevitable, I think, with an ageing population. That's what happens. And as I have told the Council of Ministers repeatedly, you have a choice to make. You fund services, or you cut services. There's this fallacious idea that there are, tens of millions of pounds floating around in Manx Care that you could just cut tomorrow. You can't. You can definitely save money. You can definitely do things better, but it takes time. These things are not going to happen quickly. And one of the reasons I resigned back in October was because I told the Council of Ministers this until I was blue in the face, that they are going to have to make a choice to either properly fund services and accept transition and change will take time, or you're going to have to be cutting frontline services, because there isn't anywhere else to go to make the savings they want to make in the timescale they want to make them in. They didn't listen, they didn't believe me, and that's one of the reasons I resigned, because I was adamant and I was 100% clear with them. Not only was I clear, Manx Care were clear with them, that this is where we would end up if they did not change course. The government refused to change course, and so now, lo and behold, we're in a situation where service cuts are happening. But worse than that, service cuts are happening and the government is not telling anyone about it. They've opted instead to try and mislead people, to stand up and be pretty dishonest, actually, about the way they've handled this whole thing. And now we've got an information vacuum floating around, because we haven't heard from any official source in government about what's actually going on.
Well, we have heard from the Chief Minister and the Health Minister now, and indeed from Manx Care. And aren't you just being a little bit selective in terms of the facts that you're quoting? Because the press release, the embargoed press release that was ultimately withdrawn, which you then leaked, it was withdrawn because the Minister disagreed with it.
The Minister may say that now, after the fact, but the reality is, look at the press release that was issued and the press release that's come out from Manx Care now about what they've approved. Tell me what the difference is. The only difference is on island electives. All the off-island stuff is still being cancelled. So the reality is that press release is still valid.
And when you say all the off-island stuff has been cancelled, the off-island follow-up appointments have been cancelled.
No, well, you've heard yourself from people telling you about actual procedures being cancelled.
And the Minister has explained that this seems to be a miscommunication or a misunderstanding, because at no stage were the Category 1 and 2 appointments to be cancelled.
So that is not what's happening on the ground, and that is clearly not what the original press release states. It talks around cancelled procedures, not just follow-ups and appointments. Procedures is the word used. That's, as far as I can tell, that's changed. And the point that I'm trying to make is, no one's heard anything. So they've now gone on the radio, finally, after more than 24 hours of absolute silence from the government on this, they've gone on the radio. Do you know what Tynwald members have been told about this? Nothing. There's been no update, no information at all to any of us. So we're being asked by constituents what is going on. And the only answer I can give them is, I have no idea what is going on.
The Chief Minister has described this as perhaps an information issue that needs to be resolved, and the government needs to be better, particularly in this case the health service needs to be better in terms of that public communication. Is this not just a storm that you're creating in a relatively small teacup, and that actually the people who've replaced you are trying to get on with the job that you left, and your interference is kind of making their life much more difficult and their work much more difficult?
So the Chief Minister is heading up a government that is stopping people being treated, that is cutting surgical procedures for people on the island. They have made a conscious choice to do that. They made that choice weeks ago. Weeks and weeks ago, that press release was ready and drafted, and a press release isn't the first thing you do. That's the end of the process. So these decisions were made weeks and weeks ago. This government stood up and told Tynwald there were no cuts coming, that no services were under threat. Those were the words used by the minister. No services are under threat. They have said this, they have done this, and now, when they've been caught out, they're suddenly trying to make everyone else at fault, trying to blame other people. Well, I'm sorry, but the reality is, if they are going to make these decisions, they stand up and they be accountable and be responsible for them. Don't try and pretend that this is just an information problem. It's not about actual people. Or we've just miscommunicated. You haven't miscommunicated. You've made decisions that are affecting people's lives, and you're refusing to accept responsibility for that.
Is it not possible that you've got this wrong? That actually the minister, imagine you were still minister and someone was coming at you in the style that you are at the current health minister, and you had genuinely tried to solve this issue. You had been made aware of this of the media release. You had felt that there were still ongoing discussions and the media release was premature, and then someone comes along, leaks a media release that you hadn't agreed to, and effectively starts creating more trouble in an already difficult situation.
So I would never have stood up. If that situation, as you describe it, is what's going on, that there were ongoing discussions, that's what I would have told Tynwald. I would have said there are ongoing discussions about service cuts, not no services are under threat, not there are no cuts coming. I would have said, actually, in honesty, it is difficult, and we are talking about potential measures we could take to come in on budget. We are talking potentially about some service cuts, and that's what I would have said to Tynwald. That is not what they said. What they said was, no services are under threat, no cuts are coming. In fact, I'm not aware of any cuts. We've heard already, this morning on the radio, in fact, that the minister was briefed prior to Tynwald. So the idea that this has all come out of the blue, that the minister doesn't know what's going on in her own department, is clearly not the whole truth.
And I'm not sure that's how... I mean it's an interpretation, but certainly the minister, in the interview we've just heard, has been very, very clear that in her mind she was asking or answering a question which related very directly to the doctor's pay dispute. And what she was saying in answer to that was there would be no cuts associated with that pay rise. She has acknowledged that perhaps she should have made it clear that just because there would be no cuts in services associated with the doctor's pay dispute, that that didn't mean that there wouldn't be potentially other service cuts. So she has acknowledged that perhaps she could have been clearer, but as in her view, she was answering a question about the doctor's pay dispute.
She was answering a question about service cuts and threats to services. That was the line of questioning.
In relation to the doctor's pay dispute?
Not just in relation to the doctor's pay dispute, because we all know that budgets aren't allocated in that way. You don't get £5 for this and £10 for that. You get a budget, and that budget is to be held to. And how you divvy up that budget, by and large, is a responsibility of the department and of the minister. So what she's really saying is she's made a conscious choice to go to the Treasury and ask for money to fund the doctor's pay award, but she's also made a conscious choice not to go to Treasury and ask for money to fund off-island elective procedures. That's really what she's telling us, if that's the truth. And this is the problem. I can't believe a word that this government is now telling us, because I know for a fact that they've stood up and told Tynwald one thing, knowing that they were telling the media something else. We know that what they're telling us is not the whole story. We know that it's still media silence almost from the government. We've had no official communication from the government, no email, no message from the Chief Minister or the Health Minister saying members will tell you what's going on. Absolutely nothing. They are running scared, and instead of standing up and accepting responsibility, they're trying to cast the blame on other people. And actually, all we've really done, and it's not just me, there are other members here who are all asking the same questions, all we've done is stand up and say the things that government has tried to keep secret.
Is this not just sour grapes on your part? You resigned as minister because you couldn't get council of ministers backing for the 16 million overspend. It now looks as though Mrs. Christian has been successful in getting the money for that overspend to get her through to the end of this financial year.
The reality was government were always going to have to fund that overspend. They just didn't like it, but they were always going to have to fund it. And if that's the case, that throws another question up, is if they're saying it's going to be £16 million anyway, what they're really saying is we've made these decisions and caused this chaos and harmed all of these patients to save what? £500,000? I mean, in the grand scheme of things, if they're coming back to Tynwald and asking for £16 million, why didn't they come back to Tynwald and say, or it could be 16.5 and we won't have to cut any services? No, again, it's a conscious choice they've made. And this is kind of the issue I've got here, is this stuff doesn't happen by accident. This stuff isn't happening because of inertia. These are conscious decisions that are being made by the health minister, and I'm assuming by the council of ministers. And I say assuming because, once again, we've heard nothing, not officially. And the other problem I've got here is the things that I'm hearing unofficially directly contradict, in many cases, the things that the official narrative is putting out. And at this moment in time, I am more inclined to believe what I'm hearing from people on the ground than I am to believe what ministers are saying.
That was Ramsey MHK Laurie Hooper. So what do you think? Despite coming from her sick bed to talk to us, was the minister's explanation persuasive? Did she mislead Tynwald, or is that just a bit of mischievousness from those plotting her downfall? Is Laurie Hooper's intervention fair? Is he helping or hindering public understanding of the enormous financial challenges presented by Manx Care? I'm Phil Gorn. Go to Myers and Thanks for listening.